Welcome to the Person-Centered and Behavioral Support Training, presented by Vagthal's Residential Care Center, Inc. We begin today by discussing the importance of caring for people with dementia. Dementia is a relevant topic as many of our elderly residents are aging. It affects memory, thinking, communication, and behavior. Remember that residents are still adults with rights and preferences. Residents with dementia may forget recent events, become confused, repeat questions, or have changes in mood or behavior. It is important to remember that these changes are not intentional. As direct support professionals, you should be patient, use clear communication, follow the care plan, maintain routines, and gently reassure and redirect. Avoid arguing, rushing, using baby talk, or taking behaviors personally. Next, we will cover techniques and tools for providing person-centered support. Effective support techniques include active listening, positive reinforcement, and empathy. Tools such as communication boards, visual schedules, and adaptive equipment can also be helpful. Strategies for building rapport include empathy, understanding residents' backgrounds, and using individualized approaches. The focus is on building trusting relationships where residents feel valued and respected. Family members provide valuable insights and emotional support. Encouraging collaboration through regular communication and inclusion in care planning improves care coordination and resident well-being. Interdisciplinary collaboration is crucial in ARF-RCFE environments. Effective collaboration means communicating clearly, sharing insights, and working together for coordinated care and improved resident outcomes. The interdisciplinary team, or IDT, can include DSPs, house managers, service coordinators, nurses, physicians, behavioral therapists, day program staff, and families. Each member brings a different area of expertise. DSPs play a critical role as they spend the most time with residents and observe daily changes. Your responsibilities include following the care plan, observing and reporting changes, and documenting objectively while respecting confidentiality. House managers and administrators are responsible for coordinating communication, ensuring IPP implementation, supporting staff with training, following up on recommendations, and maintaining compliance. Examples of collaboration include a DSP reporting a behavior change that leads to a medical evaluation or family history leading to adjusted care routines in the IPP. Staff must follow the chain of command, share information accurately and timely, avoid assumptions, and protect confidentiality. Interdisciplinary collaboration is essential for safe, consistent, and person-centered support. We now transition to covering person-centered care and crisis prevention. CPI, or Crisis Prevention Institute training, teaches staff to prevent crises, recognize warning signs, respond safely, de-escalate situations, and protect resident rights. CPI focuses on prevention first. CPI training is mandatory for all staff, and new hires complete it during orientation. Certification is valid for 2 years, and maintaining it is a condition of employment. All DSPs must also complete mandatory Year 1 and Year 2 DSP training. These cover foundational skills, advanced strategies, and professional development. Completion is required to remain compliant. Let's review some case studies to apply these best practices. In Scenario 1, L gets upset and refuses assistance during morning care when staff rush her, despite her IPP stating that she becomes anxious when rushed and prefers choices. Ms. L's behavior is likely due to anxiety from being rushed. Staff should slow down, speak calmly, and offer choices, as guided by her IPP. In scenario 2, Mr. J starts pacing and clenching his fists during dinner, where the TV is loud and multiple conversations are happening, which the IPP lists as triggers. Pacing and clenched fists are warning signs. Staff should lower the noise, offer a quiet space, and speak calmly. Avoid arguing or ignoring the behavior. In scenario 3, Mr. A refuses a morning shower, which is scheduled, but his IPP states he has the right to refuse care and prefers afternoon showers. Staff should respect the refusal and offer an alternative time, aligning with person-centered care. Document objectively. Mr. A declined morning shower, afternoon shower offered. We encourage continuous learning and development. Stay updated on best practices through workshops and courses. This enhances your ability to provide compassionate care and advances your career. In conclusion, person-centered care focuses on individual needs. Collaboration and continuous learning are essential for quality care. Commit to providing compassionate, effective support, and uphold the residents' dignity and autonomy. We now open the floor for questions and discussion related to person-centered care practices. Thank you for participating in this training.